Assalamu alaikum dear students, it's Dr. Masma Mehta. Welcome to my YouTube channel Medical School. Today we are going to discuss about acute rhinitis. And in this lecture we will be discussing about the causes, signs, symptoms and the complications of acute rhinitis. So let's go. Starting with the rhinitis. Rhinitis is basically inflammation of the nasal mucosa. Now dividing it into the two types, we have acute rhinitis and then we have the chronic rhinitis. So in this video, I'm only concerned with the acute rhinitis. So let's begin. So acute rhinitis is sudden inflammation of nasal mucosa, which is characterized by nasal congestion, which is the fullness of the nasal mucosa, and then runny nose. There will be sneezing, itching, and the nasal discharge. Now, this nasal discharge depends upon the causative agent. So if it's viral infection, there will be watery discharge, and if it's bacterial infection, then there will be purulent discharge. Now, acute rhinitis can be due to viral infections, it can be due to bacterial infections or irritations. Then we have starting with the viral rhinitis, subclassifying the viral rhinitis into common cold, which is also called as coryza, and influenza rhinitis. So, starting with common cold rhinitis, it occurs due to cold viruses. As the name suggests, the common cold rhinitis occurs due to cold viruses. Now, we have the cold viruses, adenovirus, picornavirus, rhinovirus, and Coxsackie virus. The incubation period of this type of rhinitis is 1 to 4 days. Now, the clinical features includes burning sensation at the back of nose. Now, it is the beginning point. There will be burning sensations in the very beginning, and then there will be low grade fever. There will be nasal discharge. Again, repeating, there will be watery discharge because it's viral infection. There will be sneezing, there will be rhinorrhea. Then we have subclassification as influenza rhinitis. So it is caused by influenza virus A, B, and C. In this case, what will be there? There will be severe symptoms like there will be severe fever, there will be severe body ache, there will be severe fatigue. So we are actually discussing and distinguish both these things. As I have told you, in this case, there was only low grade fever. But in the case of influenza rhinitis, we have high grade fever, body ache, and fatigue. All are sudden in onset. And then the viral rhinitis can be associated with exanthemas. Now, these are actually rashes which appear on the body after measles, rubella, and chickenpox. So, in this condition, viral rhinitis can also occur. Okay. So the second category we have is bacterial rhinitis. Now, it can be due to primary causes, it can be due to secondary causes. Discussing each of them is the primary rhinitis, that it is caused by the pneumococcus, streptococcus, and staphylococcus bacterial infection. However, secondary bacterial rhinitis are superimposed infections to viral infection. That is to say that whenever there will be viral rhinitis, the bacterial rhinitis can superimpose this infection, and that is called as a secondary bacterial rhinitis. Then we have the diphtheric rhinitis. Now it's very rare because almost all are immunized against this bacteria. So it is very rare but can occur due to primary and secondary to faucial diphtheria. Now it can exist in acute and chronic form. It is characterized by grayish membrane that covers the inferior turbinate and the nasal mucosa. So in this picture you can see this is the grayish membrane in the nasal mucosa and which is attached to the inferior turbinate of the nose as we have discussed earlier. Then the last and the third type we have irritative rhinitis. So you can guess the condition according to its name that due to irritants there is rhinitis, there is inflammation of nasal mucosa. So acute rhinitis which is caused by exposure to irritants. Now dust is a irritant, acid fume is a irritant, smoke is a irritant, trauma and continuous presence of foreign body also irritate the nasal mucosa, and that irritation may lead to the rhinitis. Very simple, very easy. So the next thing we have to discuss is the treatment. So the patient should take rest, plenty of water. You must prescribe a patient nasal decongestants, but warn the patient not to use it chronically because it may develop some side effects, and go for the antihistamines that will help you in to treat the viral rhinitis, and antibiotics if it's due to bacterial rhinitis, and prevention to the irritative environment if it is caused due to irritants. So that was all about. I hope you understood very well. Thank you so much. Allah Hafiz.